Hello and welcome to Sister Zandi RSA. Today we will be talking about the levels of healthcare and stages of grief. So when we're talking about the levels of healthcare, we are talking about our primary healthcare facilities, talking about the secondary healthcare facilities and our tertiary healthcare facilities as well. With our primary healthcare facilities, these are our clinics. Our clinics that you would find in most areas, and where there is not an actual infrastructure of a clinic, you would find a mobile or satellite clinic that is either there on most working days or on specific days that is known by the community. At this level of healthcare, there is no medical professionals being doctors, but there's healthcare specialists like your nurses that are trained and qualified and competent to help you in diagnosing, providing treatment, and should need be even referral to the next level of healthcare that you might need related to your presenting complaint, of course. We also look at what we call CHC. A CHC is a community healthcare center. It still falls under primary healthcare facilities. In your community healthcare centers, you would find that it has a more broader discipline. You'd find there's a particular section maybe for maternity, there's a particular section for tuberculosis, child health clinic, and follow-ups for chronic diseases like your diabetic clinic, your hypertensive clinic, your reproductive health clinics as well, and they do have an emergency center within the premises of the CHC. You can also perform day procedures or day surgeries at the CHC because you would find medical professionals, doctors available at these type of healthcare facilities. And should it be, just like in the mobile clinics as well, should it be that you need escalation for treatment of your diagnosis, you would be referred either to a secondary healthcare institution or a tertiary healthcare institution. Okay, so when we look at a secondary healthcare institution, this is a hospital. An example, your district hospitals. It doesn't have large number of beds, and it provides more of a what we would call a general long-term treatment, where you have to be admitted and you have to spend a couple of days getting bedside treatment for your particular diagnosis. There's also investigative machines available to help with your diagnosis, and there are medical professionals in the hospital as well. You can get your x-rays done. Your long surgical cases are also performed there, and there is an emergency center as well. There's pediatric units as well, and it caters for more I don't want to say generalized, but at a secondary level of healthcare. Should it be that your presenting complaint or diagnosis needs the attention of specialists, you're going to be referred to a tertiary healthcare institution, whereby you would find specialists like sub-specialists. So for example, if you are in a let's say secondary hospital and you're going for surgery, you'll be admitted into a surgical unit. But when you are in a tertiary hospital, the particular area or particular diagnosis of surgery that you need will need a specialist. Let's say you need a urologist. So if at secondary level healthcare, when you have been diagnosed and investigations have been done and maybe a surgical procedure needs to be done, but this time under specialists, you will be transferred to a tertiary institution being seen by a urologist and therefore have your procedure done by specialists. This does not disqualify or should make you believe that people working in a primary healthcare setting, secondary healthcare setting are not competent or qualified to diagnose and treat your presenting complaint or diagnosis. And as I said, should they feel from your results, of course, or presenting complaint or the results from investigations done, that you need a specialist, they will definitely refer you to a specialist hospital. Why is it important for us to know these levels of healthcare? We need to know these levels of healthcare because through research, through information, through continuous intervention of trying to alleviate the stress that comes with visiting healthcare facilities, there's been ways or measures that have been put into place to reduce the patient flow in particular institutions. For example, if you presented with diarrhea or abdominal cramps and you rushed yourself straight into a tertiary institution and without referral, you'd be in the triage, you'd be green, you'd be agitated or dissatisfied because everything else in terms of your vital signs is normal, but you're presenting with this abdominal cramps or diarrhea. And you would wait longer because you are more stable than a critical patient. You would wait longer because it is a tertiary institution and the specialists are already working with patients that have specialized cases. So they take more time with those patients. They are around the entire hospital and you would wait so much longer than you would in a primary healthcare institution where your symptoms can be investigated, treated, and should need be, you can get a direct referral, meaning that you have been seen and it has been determined that this needs a higher level of healthcare service, and therefore that is why you're getting a referral to go to the next level, be it secondary or tertiary. So it is very important for you to understand the levels of healthcare so that you go to the most appropriate healthcare institution to try to get the attention you need, the medical attention that you need timelessly. So please do take it upon yourself to try to understand within your community what clinics are available, what CHC facilities you have, within what parameters, and what could be the cause or your presenting complaint. How can it be best treated, or where can it be best treated, before putting yourself in a position of spending over a day waiting at an institution because you went to an institution that has specialists and that specialist can only see you over 36 hours later for something that would be treated and you'd be going home within 3 hours. So please, it is very important for you to take it upon yourself in understanding the different levels of healthcare and what role you have to play when it comes to accessing these different levels of healthcare. Our second topic that we will be talking about today is stages of grief. So when we're talking about stages of grief, you need to understand that stages of grief do not have a specific order. So irrespective of how I'm going to share it, it does not mean that it is the exact way you will be experiencing the stages of grief. A lot of times the stages of grief are related to death and dying, but they are very relevant and applicable to new diagnosis and disease as well. So we'll go through the stages of grief. The first stage of grief I'm going to speak about is denial. This stage of grief is when you are experiencing like feelings or emotions of numbness. You don't understand how your diagnosis has come about. You want to see certain symptoms. You want to feel a certain way because maybe you've heard of or you have been exposed to somebody with the same diagnosis and they had a different or some type of clinical presentation, or they had certain symptoms that you feel that you are not showing, and at this point you are just in denial of the diagnosis that you had been informed of. And these things that you are expecting, you're hoping they will come about so that you can confirm this diagnosis, irrespective of getting the diagnosis from a healthcare specialist. The next stage I'm going to talk about is anger. This stage, in stages of grief, anger comes about when you have like loss. you've lost your normal function, you've lost your independence due to this new diagnosis, and now you're feeling very angry. You're not able to go about life the way you used to, you do not feel like you are deserving of the diagnosis. And the next stage we'll be talking about is bargaining. So at the stage of bargaining, this is when you're thinking of a lot of what if, what if I wasn't in this certain place at a certain time, what if it's a misdiagnosis, which can happen, but unlikely, but it does happen. And you want to go back in time. You have contemplating behaviors, or actions that, okay, if I'm nice to this person right now today, maybe someone will walk into the room and say there was a mistake, I'm not diagnosed with this particular disease or illness. And you go through a lot of bargaining with yourself because you have now gotten known of this new diagnosis or disease that you have. The next stage that you might go through is depression, not might, actually you do go through, is depression. So with depression comes long-term feeling of sadness, so you are like, I'm unable to do what I was doing a minute ago. My life is going to change. Or maybe you were a breadwinner or sole provider of a household, and you are thinking about everything. I don't want to say in a negative perspective, but it has now gotten to a place where it's making you feel emotional, and the emotion that you are getting out of it is sadness, a long-term feeling of sadness. And remember, these stages do not come in order, okay? So the other stage we're going to talk about is acceptance. At the point of acceptance, you are now looking at, okay, I have been diagnosed with this particular illness or disease, but how do I go about my life going forward? How am I going to use the treatment or the therapies or interventions that are prescribed or recommended for me to help me either gain my normal function or to live with this new diagnosis or disease? So, as I mentioned, that they do not come in a specific order because we are different as a people. We don't process information the same. Other people go through the acceptance stage before they go through any other stage. Other people experience the depression stage long after they had been diagnosed. Other people go through bargaining stages when they are even in recovery of their illness or long-term illness or disease. So it is very important to be aware of the stages of grief and to allow yourselves to go through it. Or if you have a loved one that has been recently exposed to information or is newly diagnosed to a long-term illness or disease, that you are there to support them and you're able to identify what stages that they are going through and try to find mechanisms, ways in which they can work with to help alleviate or go through these stages at a smoother pace, I would say. It would be different for all of us because, like I've said before, we are different as a people. So there is no expectancy to say, no, you can only go through your depressive stage of grief for 2 weeks. It's enough now. Now it's time to go through your bargaining stage. Now it's enough. No, you need to allow, especially the person that is going through it, you need to allow time for them to go through these stages and help them navigate through them. Because for some people, if not least, they can actually stay in a stage of grief for a very, very long time. A long time enough, we can make an example where somebody is newly diagnosed with an illness or disease and they've just been going through denial since the diagnosis. It further makes them not be compliant with their treatment. They default on their treatment. They now are becoming physically weak and compromised. They think that the illness will just come about and then death will just follow. Unfortunately, it does not work that way in most instances. You will go through a very, very complicated experience of your illness, if you are choosing to not comply with your treatment, and then that would lead to your depressive stage of grief. Now you're feeling depressed because you allowed the denial to influence how you're going to make your choices with regards of healing, of recovery, or regards to living with the illness or the disease. So just play a supportive role to yourself and to those around you who are going through any stage of grief, be it death or dying, be it long-term illness, or even new diagnosis of illness and disease. So thank you very much. And for me, this wraps up the prep stage. So I was just preparing everybody of what I feel is important information for people to know before I start talking about a patient's pathway in particular disciplines and what their role is and what to expect as well. So I hope you've been watching the previous videos, and this is the last for our preparation stage. And the next videos to come would be focusing on particular pathways on the diagnosis, like emergency, surgery, maternity, neonatal, pediatric, ICU, the works. So yeah, just stay tuned and subscribe and like, and thank you very much for your support.